There are several different symptoms of TSC, and they relate to the different organ systems involved. Many children, for instance, are diagnosed during infancy after they develop a type of seizure called infantile spasms. Some babies are diagnosed before they're born prenatally by the detection of tumors in their heart called rhabdomyomas, which is the heart manifestations we see in TSC. Sometimes people are diagnosed by a dermatologist when they go in for the rash on their face that they believe could be acne, and it's actually angiofibroma on their face. And then some people are diagnosed also as adults due to the kidney involvement. The kidney involvement in people with TSC can either have renal cysts in their kidney, or they can have benign tumors called angiomyolipoma that contain blood vessels that are unusual, and they can sometimes rupture due to pseudoaneurysms and bleed. And then people not knowing they had TS could experience severe lower back pain and then be found to have an AML that had bled and then be diagnosed with TS. So the symptoms really relate to the different organ involvement. It's really important actually to identify a person, diagnose a person with TSC because we're getting better and better at keeping people with TSC healthy. So if a baby has TSC, it'd be great to know it before they develop seizures so we could educate the family what to look for. And we have better treatments now for seizures in TSC than we had even 10 or 15 years ago. And so we know that effectively treating seizures leads to a better outcome because many people have done research showing that the seizures are related to intellectual disability that affects about 50% of people with TS, are related to autism that affects about 40% of people with TS. So there really is this interplay between seizures and the other neurologic aspects of TS, and treating the seizures effectively definitely improves outcome. So knowing you have TS is an important thing.